Good afternoon. My name is Chrissy Matheson, and I'll be your moderator for today's press briefing. Just a reminder that this press conference is for questions related to the Atlantic bubble solely. Reporters will have one question and one follow-up, and we will go to the Premier for a few opening remarks.
Thank you, Chrissy, and welcome, and thank you for being here today. Today, I just wanted to announce, as already been announced, the Atlantic bubble, which is taking place effective July 3rd. As many of you know, we have gradually worked at easing restrictions in Nova Scotia. Last week, we talked about expanding the family bubble to groups of 10 and larger outside gatherings to 50. The next natural phase to that was to eliminate the barriers inside of Atlantic Canada. Pleased the premiers were all able to come together with our respective governments and public health officials to open up that as of July 3rd. You'll be able to move in and around Atlantic Canada without the self-isolation of 14 days. That will, though, remain in effect for the rest of Canada, or anyone outside of Atlantic Canada who decides they're coming into Nova Scotia or the rest of the region. They will have to still self-isolate for that 14 days. But they will be allowed to come in as long as they do that. But this is exciting news for Nova Scotia families and, quite frankly, for Atlantic Canadian families who have been missing loved ones, who are living in other provinces or unable to travel to their respective cottages or properties they would have in neighboring provinces. As of July 3rd, we will get back to what seems like what is our normal life, which is free mobility amongst our respective provinces. So I'll be happy to have any questions that you have.
Just a reminder, there will be one question and one follow-up in the amount of time that we have today. And please remember to keep your phones on mute when you're not speaking. First question will go to CBC's Jean Laroche.
Thanks, Chrissy. And if I could just remind my colleagues, there's somebody on the line who has not muted their phone. Could you please do it now, because you walked all over the Premier's announcement.
For my defense, it's French radio, but it's not me, Oliver.
Okay, babe. Anyway, I'm sorry, Premier. Could you tell us what gives you the confidence or comfort that non-essential travel between the provinces will not lead to a reappearance of COVID in Nova Scotia, please?
Well, we have had, as you know, this is our now 14th day, 15th day with no cases here. Our respective sister provinces in Atlantic Canada have continued to almost flatten the curve, eliminate any growth in new cases. That's an important part of the conversation that we have with Atlantic Canadians. At the same time, we still want people to follow those public health protocols, distancing, washing your hands, ensuring if you're not feeling well, to isolate yourself. So now is the time, considering with the number of new cases that we've seen in the province, which has been very few, and in the region very few, that now's the time to open it up.
Jean, go ahead with your follow-up.
I just wondered, Premier, how will Nova Scotia monitor or track people who show up at our borders looking to come in?
So anyone who's coming in from our province would just have to identify with whether it be a Nova Scotia driver's license if we're leaving, or vice versa, someone coming into our province showing with the respective, whether it's a health card or from the respective province, their own driver's license identified at the border, they'll be able to come in. Anyone outside of that will require and be told to self-isolate for 14 days if you don't live inside of Atlantic Canada.
Next question will go to Graham Benjamin with Global.
Hi there, thank you. Just had a question. I'm just wondering what's going to happen over the next 9 days. What are Nova Scotia's priorities to ensure that we're fully ready for the borders to be open?
Well, we're going to continue. This is really to give notice to those tourism operators that are out there that the borders will be open. I'm hoping their phones are ringing now, that people are calling, wanting to come in and visit. That will continue to happen to allow them to prepare. We as a government, as a community, will still work on ensuring that the protocols are in place. We have to have a broader conversation about the use of masks in our region, which I'm looking forward to have that conversation with Dr. Strang now. At the same time, looking at what other potential internal restrictions we could start easing off a little bit, just to allow us to get back to a little more of economic activity within the province.
Graham, go ahead with your follow-up.
Thank you. And I did want to ask about the plan for the rest of Canada. We just heard Premier Dwight Ball in Newfoundland say the tentative plan for them is July 17th, 2 weeks after the beginning of the Atlantic bubble. Does Nova Scotia have a similar timeline, a specific day planned right now?
We don't have a specific date, but I said last week that we were looking second to third week of July. That is obviously an important timeline for us. We, 2 weeks following the July 3rd date would be one where we'll be reassessing the epidemiology of our region and quite honestly looking at the rest of Canada. We're starting to see the cases in Quebec and in Ontario start coming down. Those are all positive signs. But it's certainly our hope during the second or third week of July that we'll be open up to the rest of Canada.
Next question will go to Andrea Gunn with the Chronicle Herald.
Hi there. I'm just wondering if, what your plan is to reassess this, if there's a second wave, if there's anything in place for, when things start to, most people think there's going to be a second wave in the fall. I'm curious to know if you have any plans in place for that.
Well, obviously, we're going to continue the difference between the first wave and the second wave, we should be better prepared if we continue to follow the public health protocols. There's evidence globally that the regions, the countries that have continued to practice good public health protocols, good hygiene, self-distancing, staying within your own network of that social bubble, the countries that have been able to do that have continued to keep the second wave flat and not have it put the kind of pressure on their healthcare system or on their economy like the first wave. That's where we're continuing to focus our energy, ensuring as we open up the economy that people recognize this is not the same way as it was a year ago. You have to continue to follow those public health protocols. You'll continue to have to see a different way restaurants function. I've been out myself a few times here in the province. I was seeing people wearing masks that are serving in these restaurants or in coffee shops. I haven't been wearing one typically because they've got a shield up. But I'll be honest with you, I'm reassessing that personally. I think it's not too much to ask of me or the rest of us that perhaps we should be wearing that mask when we're out, particularly when we go into a confined space like a restaurant, bank, coffee shop, until we do our business, and then take it off if we want to use it, not wear it as we're walking up and down streets. So those are the kinds of things that we're going to have to make sure that we start practicing, and particularly as we get more and more people coming into our province to open it up. And I think all of us have to do a bit of reflection and say to ourselves, how can we best respect those that we're in confines with, in a restaurant with, in a coffee shop, in a bank, other places, how can we best prevent us spreading the COVID to them? I can tell you the places that I've been in, the people who are working in those facilities are certainly respecting the customers as they come in, wearing the mask and all that. So those are the kinds of things that we'll be continuing to focus on as we go into the fall.
Andrea, do you have a follow-up?
No. Thanks.
Next question will go to Olivier Lefebvre with Radio Canada.
Yes, thank you. First question would be, I'm wondering if a resident of another Canadian province is in New-Brunswick after being isolated for 2 weeks for visiting close family member, for example. Will that person be able to come to Nova Scotia?
They will have to be able to prove they self-isolated to the New Brunswick government. They will provide them with an email saying you've self-isolated, you're free to move around Atlantic Canada. And the same thing here in Nova Scotia. If someone comes, self-isolates here in our region, they'll have to identify the day they came, where they self-isolated, how they self-isolated. They prove that, we will give them an email that will allow them to be used at respective borders in Atlantic Canada.
Olivier, do you have a follow-up?
Yeah, sure. I'm also wondering what happens if someone from outside Nova Scotia is being tested positive while he's in the province here visiting.
Well, like anyone, if we have someone that we test in our province, we would self-isolate them, force them to be self-isolated. If you're from a neighboring province, obviously you've come here in some form or another vehicle, or if you're driving around Atlantic Canada, you would have the option to go directly to home. We would report that back to the respective province. So, for example, if it was somebody from P.E.I. Who had tested positive here and wanting to go home, we would notify public health in P.E.I. that We had a positive test of one of the residents. That person is on their way home, and we expect them to self-isolate, and they would connect back in. And the same thing if one of our citizens tested positive in our neighboring provinces, that they would contact our public health, and we would isolate them here at home.
Next question will go to Jennifer Henderson with the Halifax Examiner.
Hi, good afternoon, Christy, Premier. I'm just wondering if there's been any discussion among the 4 Atlantic premiers of as to, what number of new cases, if that were to occur in a specific province, would be enough to burst the bubble.
Well, we are bursting the bubble now. That's in essence what this is for us within our region. The bubbles are down. You can move about freely. It's not only here. We'll assess it as a province, and we'll assess the epidemiology inside of our province and inside of the bubble. And if we see alarming trends and spikes with our public health, we'll then make decisions to either isolate that particular outbreak within respective provinces, or quite frankly, to isolate the province from the activity of moving about.
Jennifer, do you have a follow-up?
Yes. Premier, can you tell Nova Scotians when we might learn if there'll be a public inquiry into April's mass shooting?
I'm here today to actually talk about the Atlantic bubble, and I'll be happy to answer those questions the next time I'm out.
Jennifer, do you have another question on the Atlantic bubble?
No, that's fine. Thank you.
Next question will go to Evan Taylor with CKBW.
Good afternoon. This question pertains to if someone is exhibiting symptoms, but they've received a negative test result, would they be fighting, or are they ineligible to travel at all?
Not sure of the question. I think your question is if someone has symptoms but test is negative?
That is correct. If somebody had symptoms but they had then received a negative test result, would they be able to travel without isolating?
If they have had a negative test, yes. But I would strongly encourage all of us, if we're not feeling well, not to travel. That's a pretty basic principle that I would suggest. I know my kids wouldn't have enjoyed me traveling with me if I wasn't feeling well, so I would suggest that would be a good rule of thumb, and continue to monitor your health.
Evan, do you have a follow-up?
I do. My follow-up pertains to the P.E.I. ferry. I was wondering if this announcement means that on July 3rd, the P.E.I. ferry will open for residential travel as opposed to being exclusively for transportation of goods and things like that.
I haven't actually spoken to the ferry service, but that would be my understanding, is that you will now seeing people be able to move back and forth through that ferry service as of July 3rd.
Next question will go to Daryl Cole with Amherst News.
Good afternoon, Mr. Premier. The question I have is relating to healthcare and the bubble. Right now, there are a number of patients, healthcare patients in the Amherst area, who are being refused treatment in New-Brunswick due to the COVID restrictions. Will those, the creation of this Atlantic bubble, will that enable these people to be treated in Moncton instead of having to travel to Halifax?
Is my understanding is that now that that's a better question for the New Brunswick government, but it's my understanding is now that basically the restrictions are down within the region, those citizens will be able to go back to their normal way of accessing health care or treatment in the New Brunswick area.
Daryl, do you have a follow-up?
Yes, please. I know the border has been a huge issue for the business community in Cumberland County and Cumberland North. A great number of their clients, and in some cases as many as 40%, come from southeastern New Brunswick, Westmoreland County. With this bubble, will that mean there'll be a free flow of commerce and customers, shoppers across the border to New Brunswick and back and forth?
Yes, that's in essence what it means. You'll be able to move back and forth inside of the region, and you're raising a great point, Daryl. We talk about this from a tourism point of view, as if we're going on vacation. The reality of it is much of the commerce that happens inside of our region has really less to do with tourism and more about the normal flow of goods and services, people moving around for healthcare services. Here in HRM, for example, in Halifax, we have the IWK, which a lot of Atlantic Canadians come in to receive services. We have the VG, largest tertiary care center in the region. People come into our province for that. You just described a position where people are going into New Brunswick for treatment. And as you quitely pointed out, as I will say, the Mayor of Amherst has been vigilant in reminding me and our government about the importance of people going back and forth for economic reasons, whether it's a car dealership where people in Brunswick come to buy a car in Nova Scotia and take it home, or people just coming back and forth to do shopping. It's an important part of that area, and this will allow that to happen. And I do want to thank the Mayor and his council for their patience in working with us as we've been going through this.
Next question will go to Bill Martin with Six Rivers News.
Thank you, Premier. I was going to ask about the healthcare freedom as well, but that's nicely covered. Thank you. Given the epidemiology where Nova Scotia has literally tamped this down, no new cases for 15 days, no active cases at all, opening us up to travel freely from outside, would you regard this as the greatest challenge yet?
And, you know, I would say to you, dealing with the virus and long-term care facilities in our region and our country has been the greatest challenge for Canadians and for government around COVID. This is the next phase for us of opening up our economy with new protocols. One of the reasons why we had to go back, when you go back to the very beginning, when we had to actually shut basically the service industries down in our province, really was to first of all stop the spread of the virus, but at the same time ensuring that the private sector and public sector understood the new protocols on how we live with this virus. And this is the next phase of living with it. And it will require all of us to humbly submit to the issues of public health protocols. None of us should feel confident about where we are. None of us should feel cocky about the fact we've been able to do some great work collectively together, or otherwise this virus will humble us very, very quickly. We should enter this humbly, thoughtfully, and think about others as we now have the ability to move about our region. This is an important step. We need to go further when it comes to the economic future of our province and our region, but this is a good first step. But I would caution all of us to humbly enter into this new phase.
Bill, do you have a follow-up?
No, it's covered. Thank you.
Next question will go to QCCR Radio, Eds Halverson.
Yes, thank you very much. Premier, it seems all the news lately has been opening. It's all been good news. Do you see a path to what we would consider the old normal without a vaccine in the next coming months?
Hi, Ed. No, I don't see a path to what is what you know, to revert back to have a July like we did last year. There will be lots of requirements in all of us to respect the public health protocols, to interact with each other very differently. I say to you in the previous caller, this virus is deadly and shows up when you least expect it. We all seen that in northern New Brunswick with just person crossing with the virus coming in from Quebec. It only takes one outbreak for this virus to actually spread quickly. That's why we all need to be very mindful of what we can do to protect fellow citizens. And but I do see a time, and we're seeing it now, where we can actually move about and we can actually have a summer that's enjoyable, one that we're experiencing Atlantic Canada to welcome new people in, same time for us to start opening businesses. I encourage all Nova Scotians to find a small business they want to, that they're used to visiting, whether it's a restaurant, a coffee shop, continue to go support them, continue to provide them support, and that will see us through this thing until we get a virus. And even then, I think you know, we're seeing changes that I think will stay with us for quite some time.
Ed, do you have a follow-up?
I do. I would just like to give you the opportunity maybe to speak to young people. A lot of them have been impacted in losing their recreational recreation programs, what they would have normally done, swimming over the summer, or hockey camps, or baseball, or some of those things that the social distancing doesn't allow them to, I shouldn't say baseball, but the other things that it doesn't allow them to do. What would you say to kids this summer who are not going to be able to be in those recreation programs?
So, listen, I think back to my own childhood, the childhood of my kids. Those were important parts of summer breaks, where you have lasting memories of successes, wins and losses, great friendships. It's tough for kids across our province to have what would be a normal summer for them interrupted. I would say to them, with their help, we've been able to work hard to flatten the curve in our province. We now need their help. We'll continue to need their help to make sure that we don't get a second wave and that we can go about providing some recreational activities. We want them to use their imagination about how they can best entertain each other. How we collectively as a community can work with them. There will be opportunities through Sport and Rec this summer, different kinds of camps. There won't be the week-long camps, but there'll be different kinds. But I want them to know that we're not making these decisions lightly. We know the impact it's having on them, and we're sorry for that. But at the same time, we want to make sure that we keep their grandparents safe. And that we keep Nova Scotians who have other vulnerable health issues safe. And that's why we're gradually reopening this in a slow, methodical, thoughtful way. Because if we don't treat this virus humbly, it will humble us very quickly. And we've seen that around the world, and I don't want that for our province.
Premier, we have a question of clarification on the line from an early response that you gave. Earlier, you said that people would have to show a driver's license or a health card at the border. Does that mean that current border controls will remain in place after July 3rd?
They will. We will still have the picket information issues there, because bearing in mind, you can currently drive through New-Brunswick from Quebec, Ontario, or the rest of the country and come into Nova Scotia. We need to make sure that those people coming in recognize that they still have to self-isolate for 14 days. So part of that protocol will be that someone coming in just near to identify where they live, and if they live in Atlantic Canada, they'll be able to go about freely without the self-isolation. But everyone else will require to be self-isolating for 14 days.
And that's all the reporters that have questions for today.
Thank you very much. Thank you all.